For this video, I will be demonstrating how to give an IM injection into the deltoid muscle. So as always, when you are going to administer medication, you need to make sure that you have the 6 rights of medication in your mind. So make sure you have the right patient, the right medication, the right dose, the right route, right time, and when you're done, the right documentation. Once those things are in place, you will perform hand hygiene. Check your MAR and for your orders. In this case, the doctor has ordered medication M to be administered IM injection at a 1 milliliter dose. So we did hand hygiene. We are going to go to the medication cupboard and find the vial of the medication M, which is right here. This is a new vial of medication, but we're going to check it out, make sure that there are no particulates in the vial or no cracks or anything off about the vial. This one looks good. So since it is a new multi-dose vial, we are going to put, I'm going to put my initials, the date that we've opened it, and the time. Now most medications are good for 30 days, but if you are unsure, you should definitely check the insert from the box of the medication to know the exact time. So we're going to pop off the cap of the medication and cleanse the top with an alcohol prep pad. Wiped off the top. Now for IM injections, you want to make sure you choose the right gauge needle and the right size of syringe. This is going to depend on the size of your patient, where you are going to be giving the medication, and also the type of medication. So a more viscous medication is going to need a larger gauge needle. For this purpose, we have a 3 milliliter syringe with a 23 gauge needle. So we are going to do 1 milliliter per the doctor's order. So I will draw up 1 milliliter of air into my syringe. Insert the air into the vial, and then holding my medication up at 90 degrees. Okay, I'm going to make sure I have 1 milliliter of medication. Now if I had, I do have an air bubble. So I'm going to stabilize this. I'm going to tap the air bubble to get it to go to the top and remove it. Okay, you can flip your vial over and withdraw the syringe. Now because we are going to be taking this to the patient's room, once I've confirmed I have the right dose of medication, I'm going to, using the scoop method, recap my syringe. Okay. I could look again at the MAR to make sure I have the right patient and the right medicine and the right amount and the right dosage site. Then I'm going to go to the patient's room. Good afternoon, Mrs. Hen. Doctor has given me an order to give you medication M. And for this medication, we're going to give it in your deltoid muscle. So to find the deltoid muscle, you are going to fully expose the arm. Let's see if I can do it. And you're going to find the acromion process of the shoulder, going 3 fingers down. You'll feel the deltoid, the triangular shaped muscle coming off there. So if you go 3 fingers down, that puts you right in that muscle. That's where you'll want to give the injection. Okay, you'll advise the patient. So Mrs. Hen, I want you to just hang your arm down at your side and relax. The other option would be to have her place her arm firmly on a surface and relax. You want to make sure that the site is fully exposed and the clothing is not too tight or cutting into the arm. Okay, perform hand hygiene. Put on a clean pair of gloves. Verify the patient's date of birth and name against their wristband, so you know you have the right patient. You're going to find the site. Alcohol the site, in this case. Okay. Wait for the alcohol to dry. Okay. Uncap your needle. Using the non-dominant hand, the thumb and index finger, you're going to hold the skin tight so you can visualize. And then holding the syringe like a pencil or a dart, you're going to inject fully at 90 degrees. Stabilize the syringe. Wait, first you're going to aspirate. So you're going to pull gently back, and if you don't get any blood return, you know that it is safe to administer your injection. If you were to get a blood return, you would need to pull out your needle and start over again. That blood would compromise the injection that you were going to give. So because we did not have any blood return, we are free to give the injection. So slowly, over 5 to 10 seconds, we're going to slowly push the plunger and then pull straight out. Okay, I like to have a gauze pad handy just to place over that site in case there's a little bit of bleeding. Just hold that on there. We're going to put our syringe directly into the sharps container. And then you could apply a light dressing or a bandage to this site if need be. Okay, I would take off my gloves, make sure that the patient is comfortable, doesn't have any questions, and then you are going to go out and document in the MAR that you gave the injection, the site you gave it in, and the arm, which side, and the dose of medication. You'll also want to include that in your nurse's notes. And that has been my demonstration on intramuscular in the deltoid site. Thanks.